Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
And I'm happy it stopped snowing.
Oh, it stopped snowing. It's about time. Collectively, we're the hosts of PodcastDX. On today's show, we are speaking with Barby. Barby has been diagnosed with endometriosis. Barby Ingle is the president of the International Pain Foundation. She's an author and a reality TV personality.
Hi, Barby.
Hi, Barby.
Welcome to the show, Barby.
Thank you guys so much. Glad to be here with all three of you.
Barby, can you start us off by telling us what exactly is endometriosis?
Sure. Endometriosis is a painful disorder, and it's usually what happens is tissue that grows in our uterus as women will be put into the body, into your abdomen, typically. And basically that uterine lining grows in other places of your body. It grows outside of your uterus and can thrive, actually. So it's typically a women's disease, but it's not always. And it most commonly will attach to your ovaries, your fallopian tubes, and to the lining in your pelvis. So it can spread outside of those areas. I've heard of people having it in their shoulder area and breast area as well.
Wow.
But typically when that tissue grows, it basically attaches to something outside of the uterus where it's supposed to be.
Okay.
What symptoms were you having, Barby, that first led you to a doctor or to a healthcare provider?
The biggest symptom change that I first recognized was painful sex.
Okay.
and so that was, back in 1997. So, I started having painful sex, and I, soon after that, I started having periods in between my periods. They weren't as bad.
Wow.
But I was having periods, and I used to be like very regular, and every month I knew what was going to happen. And then all of a sudden my periods were random, happening very frequently. And so as that got worse, the abdominal cramping and pain got worse. I didn't start my period until I was 16 years old.
Oh, that was late.
Which is kind of late.
Mm-hmm.
Kind of late for a female.
Right.
I had no cramping whatsoever.
Oh, wow.
All the way until I was about 24.
Well, that was nice. At
Yeah.
least that was a nice gift.
Yeah.
Absolutely. That was very nice. And my sister had it really bad from the start, and hers started really early at like age 12 and a half.
Oh, wow.
So I had a totally different experience of watching what she was going through and then what was happening to me. So when my periods changed and I started having them more frequently, as well as the pelvic pain during intercourse, that was when I knew something was wrong.
So it was time to go to the doctor. So those symptoms, is that the only thing that the doctor needed in order to make a diagnosis, or did you have to go through some kind of testing to determine the cause of the symptoms?
He did a pelvic exam, and he touched a certain spot in my uterus during the exam, and as a reflex, I like donkey kicked him.
Oh, yes.
Like, don't touch there.
Yeah, yeah.
So that was like his, I think, probably biggest clue that this wasn't just like a woman complaining about pelvic pain, like something was wrong.
Mm-hmm.
And then he tried some non-invasive stuff. He said, I think you have endometriosis. So he gave me like a semi-diagnosis, but he wanted me to try other things first. So he put me on a stronger birth control pill. And he said, let's see how this goes for about 3 or 4 months. So I did that for a few months. And then he said it was getting worse and worse instead of better. And he said, let's do a laparoscopy, which is where they go in with a camera through your belly button. If they see anything, they'll cauterize anything they see. So a few months later, I went through that. But that was really, he kind of gave me a tentative diagnosis without actually seeing it until he went in with a surgery and actually saw it.
Oh, okay. Okay.
Well, and Barbie, is there an underlying cause for endometriosis? Is it genetically based or something like that?
Well, it certainly, some doctors do believe that and researchers do believe that, but according to the Mayo Clinic, the exact cause isn't actually known.
Okay.
So some doctors believe that it's like a menstrual cycle that doesn't come out the normal way, that some of that backflows through your fallopian tubes and into your abdomen, and then it attaches. So some doctors believe that. Some believe that it is genetic. Some believe, and no one else in my family had endometriosis. So I don't know why I would get it and not other females in my family.
Right.
But some believe that it's some kind of hormone related situation. Some believe that it's from surgical scars and things that happen if they do like a hysterectomy or a C-section, that some of the cells from your uterus may get into your abdomen that way.
Okay.
And some believe that it's an autoimmune disorder, so that, you know, maybe it's flowing through our blood, which might be the area that best fits me for where maybe mine came from.
Okay. All right. So you didn't have any previous abdominal surgeries like a appendix or anything like that you would have adhesions?
No, not before endometriosis. I did not. I did have multiple ovarian cysts that ruptured prior to, but I did not have any abdominal surgeries.
Okay.
Through my abdomen.
Okay. Well, those abdominal cysts or those ovarian cysts, that was also painful. So
yes.
starting. I think you would have been happier starting out earlier with the menstrual cycle and having less of this problems afterwards. But all right.
Absolutely.
Have you ever heard of endometriosis before your diagnosis? You said that there's nobody in your family, but did you know any friends or anybody that had it?
I didn't. My sister had fibroids, so I knew of fibroids. And like I said, her periods came early in life, and they were extremely painful. We were very close. The only time we would fight is 2 days before her period,
Right.
because she just, that pain hit her, and she just didn't deal with it well, especially as a adolescent youth. But no, I never heard of endometriosis, and then once I got it, we didn't even really have the internet back then. I mean, we did, but I wasn't involved with or on the internet. So,
right.
So I didn't even really have a way to look up what I was going through or somebody to talk it through with.
Sure.
And I was back then there probably wasn't even a lot on the internet at that time.
No, and sometimes female problems or things that are related to the female anatomy aren't discussed routinely among people.
Right, even in family
Right,
situations.
even in family situations. It's like, oh, no, we don't talk about that. Oh, okay, well, then, and then you feel like it might be bad or taboo, and then you kind of hold. Anyway, I was just going off on a tangent. Go ahead, Ron.
And this is the woman who did not tell either of her daughters anything.
About the facts of life?
Yeah. We had to go to our aunts.
Well, you know what? I didn't want you to ever
You have
go
to deal
there.
with that? Okay. Yeah, well, my sister has had 3 kids, so I think she understands them
She
now.
figured it out.
Yes.
Can we get back to this show? We'll go to another episode later.
Okay, yeah, we'll do we'll do
Barbie, can you share with us, please, how your healthcare team helped you to treat your condition?
Sure. So, like I said, they at first tried to do something very non-invasive, just increase my dose of birth control to a stronger birth control. That didn't help. Then they did the laparoscopy, and I actually have a videotape of the doctor doing the laparoscopy, and he's like, everything looks great. He's just like talking, very casual, and he turns the camera around inside my abdomen, and he goes, oh, boy. He's like, here it is. And
So you were awake during this?
No, I have the video.
Okay.
Okay. I watched the video afterwards.
Okay.
and like, what does endometriosis look like?
Mm-hmm.
Yeah.
And it was like red spider webs and extra skin tag to like things,
Right.
but inside of me. And I could see it all. And then he just went through and started cauterizing it and cleaning up everything that he could see. And that's what he said afterwards. I got everything I could see. You should be feeling better now. And really all it did is just piss off my abdomen and piss off the endometriosis cells. And they started attacking, and it came back with vengeance very quickly. Yeah, so I went through 2 laparoscopies, and then after that, I went to a female doctor. Mm-hmm. I switched to a whole different hospital system, went to a female doctor that was there, like a women's health doctor, and she did Lupron. I don't know if any of you have ever had Lupron, but basically they put this shot of Lupron, it's a medication, into your butt, and you end up with this like third hump of a lump or something under your skin. Yeah. And I went through that for 6 months. Every month I had to go back in and get a new shot and have that lump underneath my skin. And it would, over that month, it would wear down and flow into my body. And it didn't help, but I did it for 6 months because that's what the treatments were back then. So I just was following this course of treatment. Okay. And then finally it got to a point where I did a full hysterectomy and a left oophorectomy, where they took out my entire uterus as well as my left ovary. Okay. And also at the same time, my appendix. They took that out at the same time.
Okay.
Wow.
That was a lot.
That was a lot.
Yes, it was. So you've tried quite a few different surgical procedures. And did you have success with those?
With any of them,
I mean, like, as a final result,
My ending final result was no pelvic pain and no more periods.
Okay.
So to me, that was success.
Okay.
Now, a couple of years ago, they left my right ovary and they said it was non-functioning. I still had some estrogen level in my body, but it was not, so I wasn't considered menopausal.
Right.
But my right ovary wasn't functioning. And I did stem cell therapy a couple years ago for something else. And all of a sudden, now my right ovary is fully functioning. And now I'm having some pelvic pain with intercourse. And every other month, I have some endometriosis symptoms that I had 20 years ago. So I do notice them. They're just not as severe or bad, and there's no bleeding with it because there's nothing to bleed.
But you still might have a recurrence of the endometriosis, correct?
Correct.
So do you have to follow up to see whether or not there's a recurrence now?
Well, there's not really anything else for them to take out.
Well, just as far as the going in and cauterizing the spider webs type thing again.
Well, they literally went through and cauterized everything again. So I don't know if I would, because I live with other chronic diseases. I don't want to go through another surgery like a laparoscopy to deal with the symptoms that I have now. So, and I don't know if they're directly related to the endometriosis or if they're related to one of the other conditions that I live with.
Okay. Do you use any alternative therapies, such as massage or acupuncture, to relieve some of the leftover symptoms that you're dealing with now?
I do use massage, and I use heat therapy.
Okay.
I don't use the actual heating pad. I use they're like rice beans.
Oh yeah.
Inside this coffee syrup. Yeah. So I use that, and then the massage, and then also instead of acupuncture, because of the other autoimmune diseases that I have, I don't use acupuncture, but I use acupressure.
Right. Okay. Got it.
And then there's also this device called an OSCA, which is a magnetic pulse device.
This is the second time we've heard about that.
How do you spell that?
I just started using it. I started using it a few months ago, and in some places of my body, I don't like it so much, but for my abdomen, I really like it a lot.
How do you spell that device? O-X?
Oh, it's O-S-K-A.
O-X-K-A. I'm going to have to look that up.
Yeah, it's definitely been helpful for me, especially with my lower back and abdomen challenges.
Okay, all right.
Barby, from what you've been telling us, it sounds like you've been through a lot. What type of support have you gotten through your journey with all of this?
Well, yes, I've been through quite a lot, and I can tell you 22 years ago, when I got endometriosis, I was married, and I'm married today, but to somebody different.
Okay.
Who's a lot more supportive and loving and helpful. But my first husband was used to our life and the way things were, and he, I was totally healthy and active and the breadwinner and was living a great life. And so this, with endometriosis, for that 2-year period when I was going through all these tests and procedures and everything, he was extremely helpful. But after I got through it, I developed other conditions, and he was not so helpful with that, and we ended up divorcing. But I think God had a better plan for me and a better fit for me, and that was just part of my journey. My husband, my family, even when I went through the hysterectomy, my older brother and my father flew out to stay with me and helped out for a week. My in-laws let us stay at their house for a month because of they cut my abdomen open to do the hysterectomy. And so you're down for about 6 weeks where you can't do stairs. You can't really do much after that procedure. And so I really had a lot of family help.
That's
on
very
my
good.
side of things.
Yeah.
Very nice.
And my husband's side. Yeah, a lot of people don't have that pleasure. So definitely lucky in that area. I didn't even know of a support group, support groups existed at this time, if they did. So I didn't really have that kind of luxury to work with other people with the same disease. At that time, I was the only person I knew. Now I know a lot of people that have endometriosis and are friends with a lot of people. And definitely we lean on each other and have that support in place now, 22 years later. But at the time, I was kind of doing it with myself and my family, and we were all learning together.
Mm-hmm.
Well, that's wonderful. I'm glad to hear that you have a wonderful, supportive family.
It is.
Barbie, can you tell us how common is endometriosis?
It's estimated that about 1 in 10 women, live with endometriosis during their reproductive years, which is 15 to 49 years old. And worldwide, that's about 176 million women worldwide, according to the endometriosis.org website.
That's a lot,
endometriosis, yeah, it's a lot. There's been 20 cases of men reported that have endometriosis, which maybe they aren't. I don't know. I was like thinking about that statistic and thinking like maybe they are hermaphrodite or something.
Right.
Like
Right.
maybe they have
Sure.
something going on that they're classified as a man, but maybe
Yes.
they're
Mm.
a
Dual
combination
sex,
or something
right?
like
They have
that.
dual
Right.
sex organs, right?
Right.
Yeah.
Quite
If we
possible.
looked at their genetics, would
Sure.
they?
Mm-hmm.
Yep.
Yeah.
Do you have any, Barbie, do you have any tips, hints, or advice that you could give somebody if they were recently diagnosed with endometriosis? Now that you've been through it, maybe you could help somebody out that's listening. They'd love to hear more about it.
I would say, like, I went through a 2-year period of all the symptoms, and to me that was a little excessive. I got through it, but had I known and had the resources available nowadays, I would have gone to get better support. I would have talked to more people that knew about it and are dealing with it, definitely. And I would have taken better care of myself during that time. Not that I wasn't, but I tried to ignore the symptoms, especially in the very beginning, like, oh, this is just a bad month or this is just something. But then when you're bleeding all the time, it can weigh down on you. So talk to somebody about it. And then also go for the massages, do the heat massage and the acupuncture, if that's helpful for you. Do the non-invasive things that are at your or more readily available for you on a day-to-day basis in between the doctor appointments and figuring out what you're going to do with medications and surgery. I have a friend, Kirsten, who has endometriosis, and she was actually able to have a baby. Most of the time, including myself, when you develop endometriosis, it can affect your fertility.
Mm-hmm.
So don't be afraid to work towards having a baby. The doctors told her she couldn't have a baby, just like they told me I couldn't. And I did have a miscarriage, at least one that I know about. But with her, she had gotten pregnant, and the baby, it stuck, and now her baby's 7 years old and thriving. So don't give up on having a baby right away, and don't necessarily jump to a hysterectomy right away. Try some of those non-invasive things. And with her, and I hear from other patients that have gone through and had children with endometriosis, her symptoms got better during pregnancy and for the time she was breastfeeding.
Oh, okay.
So,
Interesting.
Okay. So maybe the hormone level may have had some kind of an impact on those symptoms there.
Absolutely. With her, they did, and with other people, I'm friends with her, so I kind of know her story really well. But with other patients that I've talked to, they report the same type of thing. When they were pregnant, they got a relief from the endometriosis symptoms.
Okay.
So maybe consider that if you're able to get pregnant. Now, like I said, many of us, probably a majority of us, are not able to. But for those who are, that could be helpful.
Thank you.
Okay, Barby, thank you so much for joining our show today and for sharing your story. Can you tell us how we can learn more about you?
Any social media or?
Yes, I'm on Twitter, Facebook, Instagram, LinkedIn, and I also have my own website, barbyingle.com. And on Twitter and Facebook, I'm Barby Ingle, and on Instagram, and on LinkedIn, I'm also Barby Ingle. On Instagram, I share it with my husband, and it's called the Ken and Barbie Show.
Oh, the Ken and Barbie Show. That's cute.
Very cute.
Well, my husband is Ken, and I'm Barbie. So
okay, very cute. Very cute. Well, thank you, Barby. Thank you for sharing your story today. We really appreciate it, and it was very informative. If our listeners have any questions or comments related to today's show, they can contact us at PodcastDX@yahoo.com, through our website, PodcastDX.com, on Facebook, Twitter, Pinterest, or Instagram.
And if you have a moment to spare, please give us a 5-star review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime, and never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
Till next week.